I'm Anne-Marie McQueen, journalist and proud 50-ish woman, and we are here looking for the true truth in perimenopause, menopause, midlife, and beyond.
Opening our minds to other possibilities is not always easy.
Hotflash Inc.
You're all woman to me. All right, Anne-Marie.
I want to thank Kion Aminos for being a gold sponsor of the Hotflash Inc. Summit. It was the first one, and it means the world to me that they went on a limb and sponsored it. Kion Aminos is such an interesting product. Like, everyone's arguing about creatine, and it's over here giving you 9 essential amino acids in the exact ratio that your body needs to build and repair muscle. Clinical research shows this leucine-rich formula is up to 6 times more effective than whey or food-based protein gram for gram. It's sugar-free, vegan, non-GMO, and very important to me moving forward and choosing brands to work with, third-party tested. When I say I notice a big difference, and in a time of large stress, when I'm drinking this every day, I am sharper and I have more energy. This is a clean, science-backed product. If you want to try it for yourself, go to getkion.com/hotflash for 20% off. That's getkion.com/hotflash for 20% off. Thank you again, Kion.
Today's guest on the podcast is a long time coming. In 2023, the North American Menopause Society, it was called the North American Menopause Society then, came out with their new guidelines for non-hormonal treatments of menopause symptoms. When it comes to things that have been clinically studied, it's pretty slim pickings. But at the time, it was cognitive behavioral therapy is the gold standard. When they mentioned mindfulness and a few other things, and they mentioned hypnosis. But then in 2024, now it's called the Menopause Society, new research from Baylor University was presented that compared hypnosis for hot flashes and cognitive behavioral therapy for hot flashes. And hypnosis came out way ahead. I mean, it was reducing hot flashes by 70%. And that's like, actually, you're having, say your hot flashes are 100%, it's cutting them by 70%. I mean, hormone therapy is like 80%, 90%. So very, very effective. That research was being conducted at Baylor University, and I tried to interview the people at the time, and I just didn't get a response, and I got busy. And then I was actually trying to find a discount code to share with people for this app called Nerva that I use to help my gut health that involves hypnosis and talking about the gut-brain connection. And it turns out that they are the people who have the Evia app, which is the app for using hypnosis, a self-guided app that you use at home for hypnosis for hot flashes, and it can also help with sleep. And that's how I came to get an interview with Dr. Gary Elkins, the man who has been doing all of the hypnosis research for women in menopause. Dr. Elkins is a professor of psychology and neuroscience at Baylor University and director of the Mind-Body Medicine Research Laboratory. He has spent more than 25 years researching clinical hypnosis. His work has focused on applying hypnosis to treat hot flashes, sleep issues, other things as well. It has shown benefits for sexual function. Now, he cautions that you can't use hypnosis for everything. It doesn't help your bone health. And while it might help sexual function, it doesn't really do anything for the genitory syndrome of menopause, vagina stuff that people suffer from. But it is very, very effective for hot flashes. And it's something you have to do every day for a period of time. And if you're interested in that, you could check out the Evia app. Dr. Elkins' research has been funded by the National Institutes of Health for decades. He's published more than 100 peer-reviewed articles, including a clinical study on hot flashes and the comparison study I mentioned. He's also written a book, Hypnosis and Hypnotherapy, What You Need to Know, as well as the Handbook of Medical and Psychological Hypnosis and Introduction to Clinical Hypnosis. So I think you're really going to enjoy the way that he speaks about this. This is not it's all in your head. And he talks about the triple fallacy problem, which is that if there's a physical problem, people believe there needs to be a physical cause and a physical solution. And so if you're having a physical problem of hot flashes, people think that there has to be a physical solution, but you can actually be having a physical problem. Hot flashes are a real physiological problem, and we go through all of the reasons that they happen and how hypnosis can intervene, but you can have a mind-body solution that will work, because that is the power of our mind. That is the power of getting in past into the subconscious, or the ability of us to have um, the experiences that help us to relax. I think more than anything, this speaks to how much stress we're under. And this interview dovetails and goes through everything. And there's a really nice thing, because it was born out of breast cancer survivors who needed options, and the chill that happened in the wake of the Women's Health Initiative findings that have been in the news so much of late. So I hope you enjoy my interview with Dr. Gary Elkins. I'll be speaking to him again for sure, because he's working on a new study on inducing psychedelic experiences, but using non-psychedelic substances, so breath work, hypnosis, etc. But today we're talking about hot flashes, we're talking about sleep, we're talking about all the things that hypnosis can help you in perimenopause and menopause. I hope you enjoy our discussion. All roads in hypnosis and menopause lead to you, Dr. Gary Elkins. They lead straight to Baylor University and your work there. That's the way it feels like. You're the nexus.
Well, thank you for saying that. This has been a line of research that I've been engaged in for almost the past 25 years, leading up to the most recent studies.
How did you get started in this line of research?
Sure. So I was working in psycho-oncology, application of clinical hypnosis, and in treatment of symptoms that are associated with breast cancer, such as side effects of chemotherapy and pain management. And at that time, we're going all the way back to the early 2000s, 2001, 2002. And at that time, there was the study, the Women's Health Initiative study came out, and there was concern about use of hormone therapy, and particularly the limited options that are available for breast cancer survivors as they experience hot flashes and menopausal symptoms. I was fortunate enough to work with an oncologist who was very interested in how clinical hypnosis could be used. And we began to discuss about whether hypnotherapy or learning self-hypnosis could have a beneficial effect on hot flashes. And based on that, an intervention was developed specifically for reduction of hot flashes in both postmenopausal women and breast cancer survivors. And I will say I was really happy, surprised when our initial studies showed about a 70% reduction in hot flashes in breast cancer survivors. And so that really got the research and the excitement going on in this area.
What does that translate to in like absolute terms when you say a 70% reduction?
So what I mean is that as women enter menopause, whether it's in breast cancer or chemically induced or just natural menopause, so there is a decline in estrogen, and the vast majority of women, around 90% or more, experience hot flashes. Hot flashes can be sort of rated from mild to moderate to severe to very severe. So they can really be very problematic. The most effective treatment for hot flashes is, of course, hormone replacement therapy, which reduces hot flashes by about 90%. So what that means is whatever, if the woman was having 90 hot flashes a week, it goes down to 10, 90% reduction. And so the hypnosis intervention has somewhere between, well, around a 70% reduction. So It's the most effective behavioral intervention that's available. It performs pretty well compared to drugs or to some extent even hormones.
Yep. Okay, so walk us through what we need to know about hypnosis because I do think a lot of us, think it's a weird thing, it'll make you talk like a chicken or whatever. We went to those university uh shows. They had those traveling shows and it was always the talk of the town. But why, what is, first of all, what we need to know about the practice of it, and second, what is it actually doing in the brain?
Yeah, so maybe I can just start with the definition of hypnosis, because you're right. Hypnosis is a term that has been around for a long time. It has a lot of research support behind it, but it's been portrayed in movies and hypnosis shows where the person might do something embarrassing or, like a magic show. In our work, most people, if they're referred or they're considering clinical hypnosis for management of hot flashes or pain or irritable bowel syndrome or some other difficulty, they realize that it's not like magic show hypnosis. In 2014, the American Psychological Association established a task force on definition of hypnosis, just so we would have a very clear and concise definition of what are we talking about when we say the patient was treated with hypnosis. I chaired that task force, and the findings and the definition were published in the International Journal of Clinical and Experimental Hypnosis. The definition of hypnosis is just simply it is a state of consciousness involving focused attention and reduced peripheral awareness, and characterized by an increased capacity for response to suggestions for changes in physiology, behavior, thoughts, or emotions. So, if you sort of break that down, what hypnosis is first, it involves a focus of attention. Many mind body therapies involve a focus of attention, such as meditation, mindfulness, or relaxation based interventions. Um, it's just that with hypnosis, that focus of attention is more intense so that other things begin to kind of fade to the background. And then there's the intentional use of positive suggestions that are directed toward whatever is proposed to be the underlying mechanism, what's causing the symptom in the first place. And so, in that way, there's sort of an overlap between hypnosis and, for example, mindfulness or relaxation based interventions. But then there are these very, very important differences in that we do consider individuals' hypnotizability. We know that hypnotizability is normally distributed as a trait. And then there are these suggestions. So, for example, in treatment of hot flashes, we know that hot flashes represent a dysregulation of core body temperature. Core body temperature is regulated by the hypothalamus in the brain. So, what we propose or understand is that as estrogen levels drop, the hypothalamus is not regulating body temperature as it should. And so, if the brain perceives heat, like you're hot, it will trigger sweating. That's a hot flash. It triggers sweating, which is designed to sort of cool the person down. So, in hypnotherapy, a core aspect of the suggestions are self-hypnosis and mental imagery for coolness. So if in a hypnotic state, the woman experiences mental images, experiences coolness that is internally generated through hypnotic suggestion, then no hot flash occurs. And that's exactly what we see. Hot flashes begin to decrease, honestly, after the first week or two of daily practice of self-hypnosis.
You know the feeling when you tried all your health trends, but you're still tired, foggy, or just not yourself? It's not your fault. True health starts deeper at the cellular level. Enter the first ever longevity gummies powered by MitoPure. They're the only clinically proven urothalin A gummies designed to recharge your cells, boost energy, and help you feel strong and vibrant from the inside out. They taste great. I've tried them. They're vegan and clean. And MitoPure's own testing shows they can add up to 12% more muscle strength in just 16 weeks. It's like giving your body a daily cellular tune-up. If you want to feel energized now and as you age, click the link to timeline.com in the show notes and use my code HOTFLASH for 20% off your first order. That's timeline.com and code HOTFLASH for 20% off your first order.
I have so many questions, but first of all, just from estrogen as the gold standard and replacing estrogen as the gold standard would suggest
Right.
that you need that hormonal intervention in there. But if you can reduce hot flashes by just almost as much as estrogen, then it's not about the estrogen.
Yeah, so there are different pathways toward regulating core body temperature. And so one way to think about it is the average age of menopause onset is about age 52. And hot flashes can last in the range of 10, 15 years. They can last longer. But for most women, even if they don't have any intervention at all, hot flashes eventually begin to decrease. But estrogen levels do not rise with age. So what that means is that the hypothalamus, the body, the brain is regulating core body temperature normally. What we believe is that with hypnosis, it's a different mechanism than estrogen replacement therapy, but it's facilitating this natural process that the brain begins to return to homeostasis. It begins to regulate core body temperature naturally. It's just that we believe that with the practice of self-hypnosis, that natural process is facilitated so that it occurs over a matter of weeks rather than a matter of years. It is important that women who are doing this type of therapy, it's pleasant, but they have to practice it about every day in the beginning. Like it's if you miss a dose of self-hypnosis, you're missing what you need for your body to start regulating temperature. It can also have the added effect, like hot flashes they're physical, they're biological. There's nothing psychological about them that has a cause, but they can be triggered. Like they can be triggered by anxiety. They can be triggered by spicy foods. They're different. I mean, during that period of time where hot flashes are occurring, there can be a lot of triggers. And so the practice of self-hypnosis is very relaxing. It's very pleasant. And so what we found is that anxiety does come down. And so that trigger for hot flashes is lowered also, along with these other type of suggestions that are directed toward the underlying cause of the hot flash in the first place.
Okay, so it's a combination of sort of giving your brain like a cooling the cooling mechanism, the cooling instructions that it needs, that it's grappling for. Am I understanding that correctly? And then also an overall calming down.
Yes, that's right. So we what we believe is that this is the reason why in all of our previous studies over the past 20 plus years, the reduction in hot flashes have followed a very predictable pattern. So after the first week, there's about a 20% reduction. By the second week, about a 30% reduction. By the third week, the reduction is in the range of about 40%. And then by the fifth, sixth week, hot flashes come on down. They decrease even further. And so that initial reduction is partly due to just the calming effect. You're doing the self-hypnosis every day, sleep improves, mood improves, your anxiety levels come down. And then there's the empowerment, to have a method for control of these hot flashes. Like it's empowering, meaning it's giving the person a method that they can regulate their own responses, not only to stress, but to the actual occurrence of these hot flashes.
So in the North American, it was then called the North American Menopause Society in 2023. Hypnosis was mentioned, which I thought was interesting, but cognitive
Yeah,
behavioral therapy, these are their non-hormonal guidelines for non-hormonal treatments.
that's right.
Cognitive behavioral therapy was like the gold standard. And then the following year, the research that you did comparing the existing hypnosis research to cognitive behavioral therapy blew that out of the water, and that was presented. So can you talk to me about that most recent study?
Yeah, so in this study, we really reviewed all the existing research for cognitive behavior therapy for menopausal symptoms and hot flashes, as well as all existing research on clinical hypnosis for uh, treatment or addressing hot flashes in both breast cancer survivors and postmenopausal women. Cognitive behavior therapy, and let me say, at Baylor University in the doctoral program in clinical psychology, I teach the course on cognitive behavior therapy. So I'm a fan of cognitive behavior therapy. It has its place. It does have a lot of research behind it for other problems, such as depression and pain management to some extent. Um, However, if you think about what does cognitive behavior therapy involve? Like, what do you do with cognitive behavior therapy? It's directed toward the thoughts, the perceptions that we have about events. And so, for example, if the person has something that happens to them and they catastrophize, they think, oh, this is awful, this is terrible, then of course it can make the perception of the situation worse. It can cause anxiety, it can cause distress. And so when a person goes through cognitive behavior therapy, they're learning about this relationship between thoughts and emotions and how if we change our way of thinking, that we're better able to cope with events in our life. So that's what has been shown in regard to cognitive behavior therapy for hot flashes. It can have an impact on the distress, how much the hot flash bothers the person. But for most women, they aren't really interested in decreasing the bothersomeness of the symptom. They want the hot flashes to go away. And so that's where the clinical hypnosis research is different because the focus of clinical hypnosis is on reducing the number of hot flashes themselves, not just coping with them, but like a hormone replacement therapy, decrease the number of hot flashes, decrease the severity of the hot flashes. And so in this head-to-head comparison of existing literature, um, the clinical hypnosis literature has very consistently shown a large effect size on decreasing the number and the frequency of hot flashes in this range of about 70%, or in some cases more.
Okay.
Remaining hot flashes, yes, clinical hypnosis can help with coping with the ones that remain, but for some women in our study, hot flashes went away altogether. And so that's where that 70% number comes from. Cognitive behavior therapy is widely known. So if you compared people that have heard of cognitive behavior therapy, it's, widely understood in both medicine and clinical psychology. But in terms of reducing the number of hot flashes, it really hasn't been shown to be that much better than just placebo.
Yeah.
Whereas in consistently across studies and across populations, the clinical hypnosis intervention, it's for real. And it can be learned and practiced, and it's the real deal. It does what it proposes to do.
Well, I think I came across your research when I was using, we're going to talk about the Evia app, but I was using the Nerva app for my own gut health problems and doing a whole bunch of other things. But I always say that 3-month program I did with Nerva was probably the most effective thing. So I'm
Yeah.
wondering when you're researching, I mean, we have gut health problems, we have stress problems, we have body pain. There's so many different things. So when you're studying hot flashes, but you must notice some other benefits. How do you deal with that in the research?
Yeah. So in our research, so in a randomized clinical trial, we evaluate hot flashes, and the standard way that that is done is through hot flash daily diaries. Although we have conducted studies in which hot flashes were measured physiologically. So there's a skin conductance monitor that the woman can wear, which really proved in that study that it's not just the perception of hot flashes, but the actual physiologically measured hot flashes decreased just the same way. We also measure anxiety. For example, there's the state trait anxiety inventory. There are other measures such as the hospital anxiety and depression scale. We measure sleep using the Pittsburgh Sleep Quality Index or the Insomnia Severity Index. And so these are like well-validated, standardized scales. And then overall quality of life. So, the degree to which hot flashes might be impacting the person's not only their sleep and their mood, but just overall quality of life. Hot flashes, they can be so severe. Some women describe them as being like a volcano going off, or just an intense heat, um, night sweats. Some women with hot flashes wake up in the middle of the night and describe the bed sheets being soaked with perspiration. And so we inquire through these questionnaires, like how severe, how much of a difficulty are these, is the symptom causing in your life? And so we measure those things at baseline, before they have the intervention, at midpoint, then at the end of treatment. And then also, we want to know, well, does these beneficial effects, are they maintained over the long run? And so we usually do about a 3-month follow-up to find out, well, how's it going after the person has gone through the 5-week program of daily practice of the self-hypnosis.
Okay. So can you say it's also addressing sleep issues and anxiety? Like, are we able to, like, just like we can say, hey, this, we've had clinical research that hypnosis is effective for hot flashes. Are you able to say that for other things? And for what things are those?
Yes, we are. One of the things that we've been particularly interested in is sleep. And so I've also conducted a series of studies really examining the impact of the self-hypnosis intervention on improving the duration of sleep, the amount of sleep that women get, as well as the overall sleep quality. In these studies, what has generally been shown is that sleep quality improves by about 50% on the Pittsburgh Sleep Quality Index. So about a 50% increase in sleep quality. There have also been studies of self-hypnosis intervention for improving sleep in aging women. Uh, those studies are in the early stages, but what they did show is that the hypnosis intervention can increase the amount of slow wave sleep, which is really, it's that, it's that deep sleep that it's not like dreaming, but it's where you're really getting that deep, satisfying sleep. And so that's where it's really directed toward. Uh, we then did additional research on sleep, and what we were interested in was, do you have to meet with a individual hypnotherapist? Like, do you have to meet with someone to get these benefits? Or could a person do it on their own and practice the self-hypnosis? And in that study, we were examining like how many sessions and what's the best way to get the self-hypnosis. So we compared individuals just doing it on their own. They got supportive phone calls. We know that support is important. And then the other groups involved in-person sessions with a therapist. Well, the results showed that the satisfaction with the treatment was just as high with self-administered hypnosis as it was with meeting with a therapist. In fact, some people liked it better because they didn't have to travel or get to a session in that way. The effect on sleep, whether it was measured physiologically with actigraphy, a device you wear on your wrist, and it can measure the amount, the duration, and the amount of sleep, or whether it was measured through sleep diaries or the Pittsburgh Sleep Quality Index, they were pretty much the same. And so what we found in that study is that clinically significant improvements in sleep were achieved through self-hypnosis. What seemed to us to be the most beneficial was self-hypnosis that's self-administered, practiced on your own, but with support, like 5 sessions, 5 weeks of therapy with support.
Is there any brain, like structural brain changes happening with hypnosis?
There are. There have been a number of studies that have really examined both the hypnotic state and then other studies that have examined brain changes that occur with specific hypnotic suggestions. So, for example, one of the very impressive studies was where they were really examining the brain changes that occur with hypnotic suggestions. In this case, it wasn't for experiencing coolness, but individuals, they looked at a figure that was in gray, so a light gray, a deeper gray, and they were given the suggestion that they could fill in the squares with color. So the person's looking at this piece of paper, it has gray, and they're given the suggestion that they will, as they concentrate, the color will change to red or blue. And as they focus and they concentrate, they can see this changes. Those that reported seeing a new color, there were activity in the occipital lobe of the brain. So just what you'd predict is if the person were actually seeing a change in color, but it's self-generated. And so just these studies of the physiology, they've really documented that first, there's a change in which the person is shifting away from the default network. It's called the default network, toward a state of consciousness of focused attention. And so this involves the prefrontal areas and other areas of the brain. I'll just say it that way. And then if specific hypnotic induction or suggestions are given, then the activity is in other areas of the brain. We've yet to examine changes in activity in the hypothalamus, which we propose is the case with hot flashes, but I'm certainly confident that's exactly what we would see because core body temperature is changed, and that's regulated by the hypothalamus. But these studies of hypnosis in fMRI studies and EEG studies, they're absolutely fascinating. I will say that without the specific hypnotic suggestions, so for example, if the person is just going through a hypnotic induction and given suggestions for focusing attention and relaxation, the brain changes for hypnotic induction and what we call a mindfulness state. They look a lot alike. So there's kind of an overlap between these different mind-body therapies. It's just that mindfulness, for example, has been examined for reduction of hot flashes. And in a very well-conducted randomized clinical trial, it did not have any effect on reduction in hot flashes, which is kind of what you'd expect. I mean, just the mindful state, it wouldn't make hot flashes go away without that really regulation of core body temperature.
I've heard it explained. I've used an app before, and I've heard it explained that the hypnosis is speaking directly to your subconscious. What do you say to that as a researcher and a clinician?
Yeah, so it depends on what's meant by the unconscious, or the subconscious.
Well, just
And
to
so,
interrupt for a minute, we hear this a lot, sorry, in the wellness space. We hear, only 5% of your thought processes are conscious, and the rest of it is sort of subconscious or unconscious. And we don't always know why we act the way we do. And so hypnosis can sort of cut through. And I'm always curious about how much is valid of that, and if that's a correct analysis of whatever research exists, in your opinion.
yeah, so I know that's sometimes quoted that we only use 5% of our brain or the consciousness. And I don't know that that's exactly true. Like what I mean is that research has suggested that information is processed at two levels. So, whatever occurs, we can process that information consciously, meaning logically, rationally. where we bring our critical judgment and thinking. But almost everybody experiences that we process also information automatically, our intuition, our feelings, our mental images. And so this processing is rapid, it's in the background. And what we believe is that it is true that during a hypnotic induction, there is a shift. We shift away from logical, conscious processing of information to experiential processing. We're experiencing the suggestions. Critical judgment is sort of set aside for a purpose. And so I do believe that with the hypnotic induction and suggestions, it's not instructions, it's mental images, it's implications, it's stories and metaphors. And in the experiential system, I believe is really where the mind-body connection occurs. For example, irritable bowel syndrome. You can't make irritable bowel syndrome symptoms go away by logically thinking about them or reading a book about irritable bowel syndrome or wishing the symptoms away. You can only have this mind-body connection by entering the state of consciousness where you're able to respond to suggestions for calmness of the gut, um, for mental images such as a river flowing gently and calmly. And so as we respond at this experiential level, the mind-body connection's there and the physiology changes. And so we do seek to move the person away from critical, logical thinking to just experience it. Just do it. Let go. Experience this state of consciousness. This state of consciousness, sometimes it's compared to going to a movie theater, and you're watching a movie and other things fade to the background. A person can just be so absorbed in what they're seeing on the screen. And although, like, I have a colleague, a friend, that he says, he goes to the movie theater and he, at one level he realizes, like, this isn't real. This is a cartoon, and it's drawn images and made up. But he said, when Bambi's mother was died, he said, I cried. Like, you suspend critical judgment. You're there. You're experiencing uh, the actual events.
Yeah.
That's what I believe is going on. But I do believe, yes, I think with hypnosis, we're tapping into what I consider the unconscious or the subconscious, or what I call the experiential system. That's really the term that I use, the experiential system.
Okay, so just describe the experiential system then for us and
Sure.
what's happening in perimenopause.
Yeah, so the experiential system is made up of that we process information through emotions and feelings, intuition, mental images. It's sort of free from logic. Like, an example of everyday experience of the experiential system. The person can go to sleep at night and they don't know what they're going to dream. And that dream can become so real. Like, they can have this dream where they were 12 years old and they were going fishing, and logically they can't be 12 years old again, but they can wake up and the experience is just as real. And so That's what I mean by the experiential system. It's that ability of our brain to respond to events and memories and suggestions and mental imagery in a way that it is real for the person in the moment. Like it's not just imagine it's happening. In a sense, it is happening as the person is in this hypnotic state. That experiential system operates automatically and all the time. So, it's if you think about how the logical, rational system works, it's really good if you're solving a math problem. Like you got to be, it's all about logic and concentration and so on. But if you're solving a problem such as how to relax or how to reduce pain, how to reduce irritable bowel syndrome symptoms or hot flashes, you got to process and experience the suggestions in a completely different way. Logic and rational thinking won't do you much good in dealing with those symptoms.
What about hypnosis do you not know that you want to learn in your lifetime?
Well, I think we're sort of tapping into it. Understanding more of what hypnosis is and how it can have such a powerful effect on different symptoms. So in my research at Baylor, we really focused a part of the research on this concept of hypnotizability. And so we know that people vary. Like some people are low, most of us are in the middle, and some are really high hypnotizable. Our research has shown that it's a trait. It's sort of an ability like IQ, for example. Like if you have high hypnotizability, you've been blessed with the ability to tap into this mind-body connection. But we don't really know yet what is it that makes a person have this high hypnotic ability. I'm interested in that. What is it that we could do that could increase everybody's hypnotic abilities? So I'm interested in this as well. And I really would like to know more about like if this mind-body connection can be so powerful as to make hot flashes go away. Like that's a pretty big statement. People who are in high, they can do it like within a matter of weeks. Our research has shown that everybody is hypnotizable. Everybody can reduce hot flashes. But for some, if they're in the lower range, it takes more practice. It might take 8 weeks instead of 3. And so this hypnotizability, like it's a real thing that we really need to know more about. And how can we increase it in people?
Well, it's interesting because I guess there's the perception out there, or it's somewhere in my brain, that if you're hypnotizable, you're not as smart. Like the smarter person. Can you just sort of dive into that a little bit?
Yes, I can. I think that's a really important point to bring up. So if you go back to the really old literature, and I mean, if you go back not just 50 years ago, 100 years ago, they used this old term, hypnotic susceptibility. And so what they thought was some people were susceptible to being hypnotized or experiencing hypnosis. And so in more modern understandings, as our research has kind of advanced, saying that someone is high in hypnotic susceptibility is kind of like saying someone is susceptible to education. Like,
Or
that,
manipulation is kind of the
yeah,
inference,
yeah,
right? Yeah.
manipulation, or that they're, weak-minded, or and the opposite has been shown. So if you look at, well, what correlates with hypnotizability, IQ. So individuals who are more intelligent tend to score a little higher on these measures of hypnotizability. Imaginative ability, creativity scores higher. Um, a study that was published over the last few years found that empathy, people who, you know, were able to experience empathy for others, scored higher in hypnotizability, this connection with others and the imaginative ability. But it's not like you're susceptible to doing it. It's really that the person who decides that they want to have this experience, they have the talent and the ability to do so. And so this old term, hypnotic susceptibility, we've really sought to move away from it. I know some people still use the old term, partly because there were these scales that were developed in the 1950s that said the scale of hypnotic susceptibility. Those scales are still around, but it's really kind of a misleading understanding of, like, what is this hypnotic ability? So we say hypnotizability is really the correct term, and it's really the opposite of what people used to think about, well, being susceptible, or it doesn't work that way at all. Like the example that I use sometimes is, if you go to the dentist and you know you're going to encounter some procedure that could be painful. Well, you're not susceptible to hypnosis. You probably would like to close your eyes and enter this deeply relaxed state. And in your mind, you might say, well, you can do your work to the dentist, but I'm going to go for a walk, down by the beach in my mind and experience everything there. And I'll be back when you're finished with, the procedure, the drilling, or whatever might be going on. And so it's that ability to do that we can be very motivated to either use our natural ability or learn how to do it.
So you've done clinical research on hot flashes and clinical studies, comparing it to cognitive behavioral therapy. What are you studying now? What are some future areas of research? Do you plan to expand it even more?
Yeah, so really two areas that are currently ongoing, and then future studies that are coming out. So the big one is really focusing on this idea that women could improve their sleep and reduce hot flashes purely through self-hypnosis. And the Evia app has been developed to deliver the self-hypnosis intervention. The Evia app is a hypnotherapy app that allows the individual to track their hot flashes so they can keep their daily diary through the app. And then it delivers a self-hypnosis audio recording, a different one every day. The audio recordings are about 15 minutes long each time, as well as special recordings for sleep. And so that's really the first thing. Like, we've already shown clinical hypnosis can reduce hot flashes by 70 to 80%. But in order for women to be able to get it, for it to be widely available, it has to be delivered through an app or in some way that it's accessible. And so our research has included studies of the outcomes with the Evia app, and finding that the results are quite comparable. And so we really want to pursue self-hypnosis. And then the other line of research going forward is sleep. So we were really impressed to find that clinical hypnosis could improve sleep in women during the menopause transition. And so that really starts perimenopause, during menopause, and postmenopause. And so really sleep for many women is as big a problem as the hot flashes themselves. And so we really want to see if we can do the same thing in improving sleep in comparison with other interventions, partly because self-hypnosis is so pleasant. It's it's a low burden therapy. You really don't have to do much except find a place where you won't be interrupted and enter this hypnotic state and just begin to experience it.
So you developed the Evia app at the university. When did that come about?
So I consulted with Mindset Health, and so the company Mindset Health developed the Evia app, and it was based on the empirical findings that have been published in both journal articles and in books and so on. And so it's really the effort was to really develop the app that is evidence-based to deliver the type of hypnosis that has been shown through research to be effective. And so, yes, I was very involved as a consultant toward development of the Evia app. I'm very enthusiastic about it.
Okay, that's awesome. I think some people think that that's untoward that you were consulting for developing. I don't personally. I think it's like you have findings and you're translating so women can use them. Is it like a profit thing, or how does it work?
Yeah, so, let me just sort of say first, the motivation behind the development of the Evia app really has been a desire to make an intervention that we found to be so beneficial to women. But I knew that not every woman could travel to Waco, Texas, to Baylor University to get it. And so we had to find a way that we could make it available in an effective way. And so as a consultant, I receive I would say a minimal consulting fee from Mindset Health for that contribution, but I don't own it or control it or have any say so in that regard. And it just is, I guess the comparison would be if it was a drug, well, physicians consult with a drug company to help them develop and make the substance available or the drug available widely.
Yeah.
And it's just in this case, it's a mind-body therapy that we want to make widely available.
Yeah. I'm a journalist. I don't have a problem with it. That's a lot of doctors do that and make a lot more money. A lot of clinicians do that. So that's, yeah. And it is, when someone uses the Evia app, is it sort of a 3-month program they follow, or how does that work?
That's right. So the Evia app, it is a 5-week program. And It provides educational materials. It allows the person to track their hot flashes and the effect on their sleep, as well as mood and stress. It delivers both a daily self-hypnosis session, and then it has special or additional sessions that can be used at night to facilitate deep sleep and reduce night sweats. At the end of the 5-week program, individuals have learned self-hypnosis, so they can do it on their own or at a much reduced fee if they just want to continue to have access to the audio recordings. That can also be an important part of the program. For example, in our previous research, we followed people after 5 weeks of self-hypnosis practice, and then 3 months later. At the end of 5 weeks, at the 6-week mark, hot flashes had reduced by 70% on average. We didn't have any further contact with the individuals in that study, but at the 3-month follow-up, hot flashes had decreased by 80%.
Mm.
So it really showed that women were continuing to do the self-hypnosis either on their own or by listening to audio recordings, and that the benefits were not only maintained, but they became greater as time passed and they continued to practice. And so we encourage that. I do want to also say support. You know, women, the average age of onset of hot flashes is age 52. That's a stressful time for women. I have learned that women in that age range live very stressful lives. They may have elderly parents that they're helping to take care of. They may have children that are either teenagers or young adults that they're involved with. They may have grandchildren that they're involved with. They're likely to be married or in some relationship. Many are in the workforce in addition to that. And so what we found was if they do the self-hypnosis, it works. But it can be challenging to find 20 minutes of uninterrupted time and support to pull away, go to a place where you won't be bothered, and just be totally calm and absorbed in using the self-hypnosis. If there's family support, friend support, encouragement, this can be very essential, valuable to the woman who wants to use clinical hypnosis, self-hypnosis, to manage hot flashes. The self-hypnosis is safe in the sense that it can be combined with any other therapy. So even if, the woman, if her doctor says, hormone replacement therapy, let's keep you on a low dose of hormone replacement therapy. That's good. That's fine. If the doctor, their physician recommends it or their healthcare provider, they can do both. And so it's just an option. It gives the individual another tool, or in the case of breast cancer survivors, they may have fewer options. And so the self-hypnosis is particularly a big deal there. But a lot of women, they don't want to take an antidepressant, or they don't want to be on a high dose of hormone replacement therapy. So it's really I'm so happy to have the word to get out that people can become aware that, hey, this is what hypnosis really is. And this is how it can really be life-changing to engage in it. I think of self-hypnosis as the new mind-body therapy. It's new because people haven't heard a lot about it, and it is different, and it can help everybody. So men too can benefit from learning self-hypnosis.
Yeah, it can help many, many things. And it's a little bit frustrating with the obsession with pharmacology. But you're right, it is something you have to do every day for a
Yes.
while to make it work. And people don't always want to do that. But I'm certainly going to be mentioning Evia to the people who ask me, what can I do since I've had breast cancer? What can I do? I can't take hormone therapy. Because for me, for my gut health, it was transformative. And I know that gut health isn't also an issue. So I'm excited that I'm really excited that you have this app and you're doing this research. And I'm happy that I finally got to talk to you.
Same here. Thank you. Thank you so much.
Hotflash Inc. was created and is hosted by Anne-Marie McQueen, produced and edited by Sonia Mack. The information contained in this podcast is intended for informational purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, read all labels, and heed all directions and cautions that accompany the products. Information received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem, i.e. menopause or anything else, or any healthcare questions, please promptly see your healthcare provider. This podcast, including Anne-Marie McQueen and any producers or editors, disclaim any responsibility from any possible adverse effects from the use of any information contained herein. Opinions of guests on this podcast are their own, and the podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about a guest's qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have direct or indirect financial interest in products or services referred to herein. This podcast is owned by Hotflash Inc. Media.